Good evening. I'm Dr. Vaishampayan, Public Health Officer for Stanislaus County. Today is Monday, March 23, 2020. I'm joined today by Gino, Patrizio, the Chief Executive Officer for Memorial Medical Center here in Modesto. So I thought I'd start today with a overview of the situation. So over the weekend, we had 3 new people test positive in Stanislaus County, and we've had 2 more reported today, bringing our total to 10. 5 have been hospitalized, and 5 have not been hospitalized. 2 are travel related, 2 are close contacts to a confirmed case, and 6 are called community spread. And I'd like to say a few words about what community spread means. This means no international travel to a country with ongoing transmission, and no contact to a confirmed case. However, these classified as community spread may not have been exposed in Stanislaus County and may have traveled within the United States to an area with community transmission. So it's a bit hard to interpret. In addition, our syndromic surveillance, the system we have in place to monitor illness in people presenting to the hospital emergency departments in our county, started showing an increase in people coming in for respiratory complaints, such as cough or shortness of breath, over the past few days. These are the indicators that we have been looking for here in Stanislaus County to let us know that COVID-19 is now starting to spread in our community. So there continues to be a lot of talk about testing. There is a worldwide shortage of various items needed for the testing process. Everyone can't be tested. This isn't unusual. Everyone isn't tested for flu during the flu season. If you have mild flu symptoms, you may or may not be tested, but the treatment is the same. If the test makes no difference in the treatment, then the test is not going to help you. So at this time, we are strongly recommending that testing be done to those who are hospitalized and those living in congregate settings as our highest priority. These are the people where the test makes a difference in their care. And it makes a difference in our work to prevent spread to other people they're in contact with. So while there's still many things unknown about COVID-19, we do know that 80%, or 4 out of every 5 people who get this illness, have a mild illness, and they don't need to be hospitalized. 20%, or 1 in 5, will be hospitalized. Since we know that 20% will be hospitalized with pneumonia, testing hospitalized people with pneumonia is a good way to know how much COVID-19 is in the community. Just like surveys at polling places don't need to know how every single person voted to accurately predict the outcome, public health doesn't need to have everyone tested to know how much disease is in the community. The testing we now have available is sufficient for us to know how much COVID-19 is in the community, so we can recommend the appropriate response to best keep our community healthy. If you're sick with a respiratory illness, you need to stay home and keep away from others for at least 7 days. This is very hard, but must be done to stop spread to your friends, family, coworkers, and community. You do not need to be tested. If you feel that you need medical care, for example, if you start feeling short of breath, call your doctor immediately. Let them know how you're feeling, and they can assist you in accessing the appropriate care for your illness. So as you know, COVID-19 spreads person to person when people are face to face, less than 6 feet apart, for 10 minutes. Spread is very unlikely to occur when people are more than 6 feet apart, or only briefly face to face. Now that we are seeing spread in our county, it is crucial for people to stay home and keep a 6-foot distance from others. This is how we're able to stop spread. The more people stay at home, the faster the spread is stopped, and the shorter the time will be that you are asked to stay home. The more people go out and mix with others, the longer it will take to stop spread. The longer shelter-at-home orders will be in place. And in addition to that, because frequently touched surfaces can have viruses on them, cleaning frequently, along with frequent hand washing, protects you and protects others. So we understand that these recommendations have a tremendous impact on all your lives. These recommendations are based on the best information we have right now. It is important to take these actions now to reduce the spread of COVID-19. This is hard, but we will get through it. We will get through this faster and better if we follow these directions, choosing to protect ourselves and others. So I will now turn it over to Gino Patrizio.
Thank you very much, Doctor. Let me start by saying Dr. V and I are good friends and colleagues, and we are modeling what we would like to say is good social distancing. We are 6 feet apart, even though neither of us are symptomatic. And that's a good model for you all to follow. Speaking on behalf of the healthcare community, first thing I'm very happy to say is that all of us at Sutter Health, at Doctors Medical Center and their affiliates, at Kaiser, at Oak Valley, and all of our clinics from Golden Valley to all of the private physicians, we all have forums where we can talk and share ideas, share practices. There are a number of measures that we are undertaking as healthcare professionals to address this public health emergency. One of the things we're doing among the things we're doing at hospitals we are restricting visitation to only those circumstances where it really is absolutely necessary. And I know that's a big change for folks. So we're really grateful for the response, the courtesy that we've gotten from all of you in this community. We've also postponed all surgeries and procedures that can be safely postponed. Obviously, if somebody's having an emergency, we have all the resources available that we normally would have to address that emergency and can take care of you in a crisis just as we would at any other time. But unnecessary things or things that can be put off safely are being put off. And then lastly, what all of us are doing is setting up processes to identify people with signs or symptoms that raise the specter of coronavirus before they come into our facility. And we have a separate process for those folks so that we can ensure that we're keeping our patients safe, our visitors safe, and our team members safe. The best thing, as Dr. V said, the best thing that all of us can do is practice good social distancing and good hygiene. Healthcare workers are the tip of the spear in a healthcare crisis like this. And one of our main concerns as this progresses is diminishing PPE or personal protective equipment. So this is not just a local issue, meaning it's not a Stan County or Modesto issue. It's not even a California issue, and it's not just a United States issue. This is a worldwide crisis. So our resources, particularly when it comes to things like personal protective equipment, are being stressed like never before. Now, I will tell you, we will be able to keep our dedicated healthcare professionals safe, but it's going to take all of us to do it. And there are a number of really easy things that you all can do to keep you and your family safe and help us get through this. First, as Dr. V said, stay home. If it's not necessary for you to go out, stay home. If it's necessary for you to go out and handle your business, and then go back home. This is going to be temporary, and we're going to get through it. But you have to do your part. Second, wash your hands. Wash your hands with soap and water. Wash them as often as you can think of to wash them. I'm a healthcare professional. I have been washing my hands more in the month of March than I think in the entire calendar year of 2019. Avoid touching your face if it's unnecessary. I have facial hair and I fidget with it, so it takes a lot of intentionality to do that, but that's going to be important. If you sneeze or cough and sneeze into a tissue, and if you don't have one, do what we in the healthcare business say, cough like a vampire, right into your elbow. It's the best way to protect. Don't cough into your hand. It's like exposing the whole world to your cough. Avoid others who may be infected or who may be exhibiting signs and symptoms of any illness. Treat everybody that you come in contact with as somebody that may be a virus carrier, which means, going back to the very first thing she said, practice safe social distancing. If you do these simple things, we will flatten the disease curve. We'll end this much quicker than some of our neighboring countries in the world, and we'll get through it together. And with that, I'll turn it back to Dr. V for some closing comments.
All right, well, thank you for tuning in, and come back tomorrow to hear more about coronavirus here in Stanislaus County.